Welcome to Riverside Reflections. My name is Denise Mananis, and I'm your host today. Today's guest is Dr. Raffaele Milizia. He is the Chief of Emergency Medicine at St. John's Riverside Hospital, and he is going to share some really exciting news about all we're doing in our emergency department, all for our community. So welcome.
Thank you. Thanks for having me.
Of course. So let's start with, before we get to all the good stuff and all the good news, let's talk a little bit about the current status of both the emergency department here in the Andrews Pavilion, but also the one in the Dobbs Ferry Pavilion.
Sure. So, I think if I had to pick a point in history where our ED started to change a little bit in terms of its mission, it was probably about 7 years ago now, where we became an academic department. So historically, Our emergency departments were always part of our community hospital. They serviced the communities of Dobbs Ferry and Yonkers. 7 years ago, we decided to turn our departments into a teaching institution, a teaching facility, and a teaching department where resident physicians were learning emergency medicine. And the reason I say that changed things is because it changed the nature of sort of who was attracted as physicians to our department and who was going to be taking care of our community. Becoming an academic department really escalates the level of care that's being provided. Mm-hmm. Everything is very evidence-based. Everything's modern and the most effective therapy. And really what that allowed us to do was change our group of physicians to folks who were recently changed as some of the larger academic institutions around the New York area and bring that level of tertiary level care to our community hospital.
That's very interesting. So tell me about that journey that you took with the residents, because I know becoming a teaching facility and having that program here, you also have to deal with your nurses and some of the other things that have changed. Now, these residents do go through both this pavilion and the Dobbs Pavilion.
Dobbs Ferry, right. Okay. And they actually rotate throughout some other bigger hospitals in New York City also.
So let's talk about that sort of, how did everybody jive and how's that going?
Yeah. So really, you always worry. The culture in our departments was always a good one. The physicians and the nurses always had good relationships. And whenever you introduce another person, you always wonder. The bottom line is the residents are now a core part of the care that we bring to Yonkers. They are now working alongside the nurses. They're learning from the nurses as much as they're learning from the doctors that are at the bedside. What does that mean for the patients? Really, for me, has been the biggest thing. Patients before used to see the doctor once or twice, the nurse once or twice, and really get one physician's opinion about what was happening. When you introduce residents, there are more touches to the patient. So now you have another physician who's seeing that patient another 1 or 2 times during their visit, another person who can explain to the patient what's going to happen, what's happening, what their diagnosis is. And really what we found was that patients were getting more information from the team, because now it's not just the attending physician and the nurse, it's a resident physician on top of it, someone who might be a little closer to their understanding.
Right.
And really it's been a great service to the community.
That's great. Can you talk a little bit about the services that sort of separate the two EDs? We call them emergency departments. Dobbs is small, so let's talk about Dobbs for a second. What's the draw? I know what the draw is, but what's the draw?
What's the secret sauce?
Yeah.
So the Dobbs Ferry ED has a great history in the community, and really, if you had to pick the one thing that stands out about the Dobbs ED, it's the efficient family feel. And the fact that even though it's small, even though it's fast, every service that we provide in terms of testing happens at Dobbs Ferry also. But you do it in a very cozy environment with a lot of one-on-one care from your nurse, from your physician. It's open 24/7, just like our larger ED in Yonkers, has CAT scans and X-rays and blood tests, all the stuff that we need to properly evaluate patients and take care of them. The perk is it happens so quickly.
Yeah.
So usually, number one thing is quality. What kind of care are we providing to our patients? But a lot of patients, when they have unexpected issues that bring them to the emergency department, they don't want to spend an entire day there either. At the Dobbs ED, we typically see patients very quickly. We can get those workups done quickly and then put them in the appropriate place after
Right.
that.
So it's very interesting because before we come to this ED and sort of talk about the differences, I do want you to just sort of talk about the quality of the providers in the practice and the physician providers.
Yeah. So that was one other interesting change too, as we became an academic department. If you rewind about 10 or 15 years, there was a group of doctors who worked at Dobbs Ferry. There was a separate group of doctors who worked in the Yonkers Hospital. Once we became an academic department and sort of attracted teaching physicians, it became a much more integrated department across both campuses. So the doctors who work at Dobbs Ferry are the same doctors who work in Yonkers. And so that escalated level of care is really shared at both sites.
Very cool. All right, so now on to Andrus Pavilion. There are some differences, some real differences in terms of the kinds of things that we do here and what we are certified to do. So let's start with FastTrack, which I don't think a lot of our community really knows about. Well, let's talk about that.
Sure. So when you get to an ED that sees as many patients as we do, and that's anywhere from 35 to 45,000 patients in a year, you start to have to separate where those patients are seen. Sick patients will go to what we call the main emergency department. The patients who are coming in with less sick issues, ideally you would want to put them in a fast-paced area where they can be seen and then sent back home after getting evaluated. So that's what we call our fast track. And we decide very early on who can go to that area. So we have very experienced nurses greeting patients at the front upon entrance. And if that patient's coming in with something that can be taken care of in fast track without going into the sort of deeper part of the emergency department, that nurse will identify that patient quickly, put them into a fast track bed, and typically we can see and discharge patients within 2 hours of the time that they get to the hospital. So that's our fast track, is really for your sort of bumps and bruises, wrists and ankle sprains, minor cuts, colds, that kind of thing.
Okay. So the other thing that I think is really fascinating is our stroke certification. And we have dual certifications. One is Joint Commission, and the other is from the American Stroke Association. So can you talk about stroke care here and what's involved?
Sure. So stroke care started here many years ago. I became the stroke medical director also as sort of my role in the chief emergency medicine. Stroke care is really at the forefront, and it's so time sensitive that it was important to have the emergency departments buy in there. As stroke care progressed and has made huge strides over the last 5 or 6 years, you could designate an institution by the Joint Commission as primary stroke certified. And we achieved our designation in 2020 through the Joint Commission. So we are a primary stroke center,
Great.
Which means that if you or any of your loved ones are having any of the symptoms of a stroke or at all concerned about a stroke, you can call 911. They will bring the patient here, and we'll have all the resources available to sort of move patients along quickly, to diagnose the stroke, to treat the stroke, and then if additional therapies are needed, we can transfer them.
That's wonderful. Okay, so that's really the makeup of the emergency department. So with that said, there are challenges in our emergency department, and I think we've all experienced them ourselves, and I know the community is probably aware of them as well. Can we address them, and then we'll get to the exciting part soon?
Right.
Yeah.
So, I think we talked before about really quality is sort of the number one thing. Patients want to come in, they want to get taken care of quickly, but also well, right? The key is they get proper care. Most of what we hear from our patients now is not so much that they feel like they weren't treated properly, but especially for those patients you mentioned before, the fast track patients. Our ED was designed to see half the number of people that we see now.
Right.
So we've had to get pretty creative in terms of where we put patients, where we evaluate patients. Unfortunately, and we recognize this, the patients who are in that fast track area, part of our struggle now is giving them a private space where they can be evaluated by the physician, really stay in one place and get comfortable until they go home. Because of the dynamics of the ER, we have to put them sometimes around other patients, and oftentimes we have to move them around during the course of their ED stay. And we recognize that that's not that's not comfortable or perfect, but that's something we're looking to fix.
So we have some great information to share with our audience, and I'd like you to announce our great news.
Yeah, so it's my favorite topic, Denise. So working alongside New York State, the hospital has applied for a grant, and this grant is meant to do a few different things, but really the exciting announcement is that it's going to lead to a renovation, an expansion of our emergency department. By the time this renovation is done, we will have more than double the number of spaces to see our patients and almost double the amount of space that the emergency department takes up.
So can you talk a little bit about, so you said something, the current design of the emergency department was built for, you had said earlier, 23,000. And the new design is going to be able to accommodate up to?
So based on the number of beds, 55,000 patients.
Wow. And so we're adding how many spaces? I think it was
28
to the current footprint, which is
27.
27. Okay. So I also understand that there's going to be different entrances. Can you sort of address that?
Yeah. So one other struggle we deal with now is that all of our patients have to come in through one place. So whether you're being dropped off, whether you're dropping yourself off, whether family members dropping you off, or whether you're coming in by ambulance, everyone is coming to the same door, essentially, in the emergency department. For our drop-off patients, that's a struggle now because there's not parking where the ED entrance is. And so with the renovation, one of the things we wanted to do was separate the folks who were coming in by ambulance from the folks who were getting dropped off or driving themselves to the hospital. The perk for those folks who are going to be driving themselves there is that there's parking right outside the new ED walk-in entrance. So you'll be able to come to the hospital in the way that you're familiar and park in the visitor lot, and you'll have a direct entrance into the walk-in part of the ED. And then the ambulances will go around back and continue to come in that way.
So that's quite interesting. So the way the construction is going to go forward, I know that there have been some preliminary designs. Tell me about what that's going to look like. So are there separate spaces for different kinds of patients? Let's talk about that.
Yeah, so it's that same sort of concept where if you come in and you're not super sick, we wanted to take care of you towards the front of the emergency department. So at the entrance and exit, so that when you walk in, you're not mingling with the other sick patients in the ER. You're coming in, you're getting quickly seen and evaluated, and then you can be just as quickly discharged. You can go right back to your car, and you never feel like you were in an emergency department. You feel like you got treated at an urgent care and then got discharged.
Wow.
And that's really the feel that we want to give to those patients. For the sicker patients, we now have much more space to put them in. What we mentioned before about moving those patients around won't have to happen as much. Patients will be able to get placed in a room and be able to stay in that room until they either get to go home or go upstairs if they need to be admitted.
That's amazing. Very exciting. So what else can you tell me about the project timeline? There is an expectation?
So our goal for St. John's is to break ground on our new emergency department before the end of this year. So the more we say it, the more excited we get about it, and it's coming up quickly. I'll tell you that the plans are looking very promising and things are moving along very quickly. We've been thinking about this for a while, so we're excited to finish it.
It's wonderful news. And I thank you for joining us today and sharing all of this information. Emergency services for our community is so important. And, it's one of those things that the community relies on us for. And I'm so thrilled. I've been here so long that we get to actually see this come to fruition, and we've been talking about it. So thank you very much for everything that you do for our community and for our hospital. We really appreciate you.
Yeah, it's our pleasure. And, our focus has always been quality. Now we're doing a little bit faster. And at the end of the day, we want the patients to have an excellent experience. And I think everything that we're doing in RED is going to be providing that. So we're excited also.
That's wonderful.
Thanks.
Thank you. Thank you again. And thank you for joining us today for another Riverside Reflections. We'll see you again very soon.